Hello there. So I had a request to talk about feline vaccine-induced sarcomas. So that's what I'm going to talk about today. I'm going to start out by saying that's actually a pretty common misnomer. They're actually called injection site sarcomas because they're not necessarily related to vaccines. They can be related to any injection that cats get, be it microchips, it can be long-acting steroids, antibiotics, pain medication, literally any injection they get can cause these. And they don't just happen in cats. They can also happen in dogs and ferrets. They're just more common in cats. Thankfully, they're not nearly as common as they used to be. We don't see them nearly as often. What they have to do with is the inflammatory response that comes with an injection. I will say cats tend to be a little bit of overreactors when it comes to things like this, so seeing it more commonly in them is not all that surprising. They've done a lot of studies on these, and the studies were mostly done on vaccines because we used to think that it was vaccines that caused these problems. And they looked at different types of vaccines, what the adjuvants is, what the preservatives were in all of those vaccines and whatnot. And they found that different brands really didn't have a difference in the amount of sarcomas that were grown. What really made a big difference was actually the temperature of the vaccine. They saw more sarcomas in cold given vaccines than ones that were allowed to come to room temperature, but they didn't investigate that enough to kind of change mandates to say only give room temperature vaccines to cats. Realistically, the way I approach these is if I have a cat that has a rapidly growing mass after any type of injection, I suggest taking it off. So some masses we will suggest doing what's called a cytology first, where we put a needle in that mass and we draw some cells out to see what type of mass it is. I try to avoid that personally whenever I'm worried about sarcomas. So a sarcoma is a family of tumors. They grow very, very fast. And sometimes if you poke them for a cytology, you just piss them off and they grow off faster. So even though it obviously has more in-depth for the patient to surgically remove something and more financially in-depth to surgically remove something, I just suggest just taking the dang thing off instead of testing it and pissing it off. I'd rather it come off and be something benign than piss it off and then it grows to the point that it can't be totally removed. Because of our, not fear, but our knowledge of sarcomas, we do tend to give injections and vaccines low in the limbs, or some places even give it in the tail, so that you have a spot that's easy to remove if they grow a tumor. If you have any other questions, or if I didn't touch on what you were looking for sarcomas, just drop me a comment and I'll see if I can cover anything else on them.